Hello, and thank you for tuning into Safety First, our Facebook Live series about keeping you and your family healthy as we navigate the post-COVID-19 world. I'm Elizabeth Van Camp, and I'm a member of the University of Iowa Healthcare social media team. UI Hospitals and Clinics Chief Medical Officer Dr. Theresa Brennan has joined us once again to offer her expertise, so please submit your questions or concerns you have in the comments below, and we'll answer as many of them as we can. Thank you for joining us today, Dr. Brennan.
Great to be here.
One note before we begin, this video is for informational purposes only. So if you feel sick or are concerned about your health, we encourage you to contact your primary care provider or schedule a video visit to speak to one of our providers. So Dr. Brennan, first up, for those who may be tuning in for the first time, can you give us a little bit of your background and how your life and maybe even your job has changed since the pandemic began?
Sure. So my background is that I'm an adult interventional cardiologist, and I continue to see patients. I see patients in clinic, and I take care of patients in the ICU, patients who have heart attacks and heart failure and things. And for the last several years, I've been the chief medical officer for the hospital, which means that I oversee a number of different areas, really focused on quality of care for patients, patient experience, ethics, et cetera. So, that job is a busy job, and I've had plenty to do over the years. But for the last several months, really have been focusing a lot on COVID here at the hospital. So I think that's changed life a little bit. Fortunately, I have a fantastic team that continues to take care of everything else while I'm focusing on COVID-19. But also my personal life has changed. I, like every other American, has been isolated, not doing the normal things that one does. I do come to work every day. There's a lot of people that aren't coming to work or aren't going to work every day. But I think it's really changed a lot of things for all of us.
Thanks for giving us a little bit of that background. Yeah, it has changed all of our lives quite a bit. I mean, I'm working from home. I've never done that before, and it's just our new normal.
Yeah.
So one of the first questions specifically about COVID-19 I want to ask is, have we reached our peak in Iowa, or do we know when a peak might be coming?
Yeah, I think the numbers are slowing down. Whether we've reached our peak or not, I think it is yet to be known. And I think we'll only know that retrospectively when we look back. I think many of the counties have decreased the numbers of new cases they're seeing, and I think that's great. There is still potential for outbreaks to occur, and I think we have to be cognizant of that. Those could increase our numbers with lots of patients being affected.
Great. So last week at our hospital, some of our visitor restrictions were updated, and we implemented face covering requirements. Can you update our audience about what that change means?
Sure. So we rolled it out on the same day. There were two parts. The first part is we recognize that patients really need their family around them when they're sicker, when they're undergoing procedures that are stressful, both physically and mentally as well. And so we broadened our visitor restrictions to allow people that are having procedures or going to the operating room for surgery to have one visitor, for patients who are in the hospital, adults in the hospital, to have a visitor, and then increase the number of visitors that a child could have to two parents or guardians. With doing that, we recognize that it's really important that we continue our safety standards and protect our patients and our staff when we have more people in the hospital in the form of visitors. And so we rolled out a required face covering for everyone. So if you're a visitor or if you're a patient, we'd encourage you to bring your own mask if you have a mask. If you don't, we'll give you one, and then we'll ask you to wear that. And that word "ask" is really, we need you to wear that. And it's really about keeping you safe, but also keeping everyone around you safe. And then we have used face shields for our staff and our faculty since really COVID started as our primary form of protection. They tend to be kind of bulky, and so some people don't take them home at night. Others do. I take mine home with me, but others choose to leave them in their office or their place of work. And so they would be going in and out of the building without a face covering. So we now have all of our faculty and staff wearing either a cloth or a medical mask, or wearing their shield when they're coming in and out of the hospital. So effectively, everyone should have a form of face covering on all the time while in the hospital. There are some patients that can't wear masks. We certainly don't want a mask on someone under 2 or a patient who can't get the mask off if something should happen that they need to take it off quickly. So patients who, and there's certain medical conditions that patients may not be able to wear a mask if they have some breathing difficulty. So we're offering those patients a face shield when they come in so that they can have a face protection.
Very nice. Thank you for explaining that change for people who may not have heard of all the details of it.
It's all about keeping us safe.
Yeah, absolutely. So what's our criteria for who can get a COVID-19 test?
So the criteria has broadened since COVID-19 first started. Initially, we were following guidelines from the Iowa Department of Public Health and the CDC because testing was limited. Since that time, we've really broadened the ability for someone to be tested, all ages, and broadened the symptoms. So you can go on our symptom checker and look for what symptoms would be concerning. And then, going through our telemedicine clinic and our ally clinic, or even your regular doctor, potentially get a test. So most patients who have symptoms that are consistent with COVID would be eligible for a test. We do test some patients that aren't symptomatic, some groups of patients. One would be, for example, patients that are coming into the hospital to have a surgery, because those patients may undergo a procedure that could cause the virus if they had it to aerosolize into the air. And in order to protect our faculty and staff, we are testing those patients.
So there's been a lot of questions. That's really good to know about the COVID-19 test, but there have been a lot of questions as well about the antibody test. Is that something we're going to be offering at our hospital?
Yeah, we do actually. The test we brought in a few weeks ago went through a pretty thorough validation process to make sure that the test ran appropriately, that the controls were appropriate, and that our people knew how to use the test. And now we've been doing them clinically. We do have a research study that will be kicked off here soon to test people. But clinically, if your physician feels like you may have had COVID and it's important to know if you did or not, then they could order that test. I think it's important to recognize the difference. I just had a conversation with a friend recently who thought they were getting the antibody test and then ended up getting a swab, which wasn't, they didn't like it very much. It's not very comfortable. So the COVID-19 test is a swab where they put a swab into your nose, actually far back. Or for people that they anatomically, for some reason, can't go in their nose, they can use the back of their throat. That tests for the virus being present now and in the upper airway. So it could be somebody who's asymptomatic who could potentially transmit it, or it could be somebody who's symptomatic to make the diagnosis. The antibody test is a blood test, so we would take a sample of blood and they'd run it.
Okay.
So you can get it with discussion with your doctor.
So I think you're touching on something that we've been talking about a lot, which is that if you think you need care or if you think you need something from your doctor, talk to your doctor. I mean, reach out. And this time it's almost easy to avoid that because we're scared to leave. You might be scared to leave the house, or you might think, well, it's just a cough, but this is really the time to reach out and talk to your provider, right?
Absolutely. And that can be by telephone, or if you're one of our patients, or a patient that goes to an institution where you have MyChart, that's a great way to reach out to your doc.
Right. So with all the demonstrations happening around the country, including several places in Iowa, we're seeing crowds of people gathering together often. And luckily, we're seeing a lot of those people wear face masks or other face coverings. But if someone wants to go participate in one of those gatherings, are there any safety recommendations you can give them?
Sure. Elizabeth, that's a great question. And I think that at this point, I'd like to kind of step back and just talk about why the demonstrations are happening, because I think it's important that we acknowledge the challenges with racism in our country. So, many institutions and leaders have put out statements about how we denounce racism and how it's wrong, and these are absolutely true. I wanted to personally today say a few words because I have personally felt that historically that I treat individuals as individuals, and I treat people with equity and justice, no matter who they are, what they look like, where they come from, what their beliefs are. But in the last several weeks, I've really forced myself to step back, and to think um, about what's going on in our country, and to really challenge the premise in myself that, I'm agnostic of race. I've done a great deal of thinking, and I have opened up conversations with my family and friends, and I think I've come to some conclusions and learned some things. I think, as we say here at UI Healthcare, we're all in this together. And I think this is a journey that we're on, and we've been on a long time. And perhaps it's a journey that we need to speed up a bit. I've also learned about myself and from talking to others that we know we can do better. I know I can do better. It's important that each of us recognizes that sometimes what's in our hearts can be translated into words and actions that can be hurtful to others. And we have to be sensitive to this. And the one thing that I've recognized is, I've heard the terms Black Lives Matter many times. And my initial instinct is, yes, all lives matter. But when I step back and think about if I were to say that to someone, how that could be hurtful, it's kind of like my husband coming home from work and I say, "How was your day?" And he says, "I have a terrible day." And I say, "Lots of people have a terrible day," right? You're diminishing the fact that someone is hurting. And I think I've learned a lot about that in hearing people talk and really trying to listen. I think it's also important that we recognize that, our Black brothers and sisters have real struggles throughout their lifetime that many of us have never faced, and that these struggles are a part of who they are. And if we want to appreciate them as an individual, we need to appreciate those struggles and how they've had impact on them. Many people have struggles, but I think that this is a special circumstance. And then finally, I think it's important that we recognize that our words matter, and that our culture isn't going to change unless each of us commits to really actively working on it ourselves, really each of us in our own daily lives. I think that this is how each of us can contribute to our better future. As the United States of America, as Iowa, we have an opportunity to have a better future being in this together. A future where human beings are seen and treated as individuals with dignity, and where we constantly work to eliminate stereotypes, really in all groups. I think this change starts with me, and it probably starts with everyone who's listening today. So I appreciate the opportunity to just say a few words about that, because I think it's really important. Now, to answer your question, I think it is, peaceful demonstrations do increase the risk because it's hard to social distance. And generally people are speaking with force. They might be raising their voice, and that actually has the potential for droplets to be more in the air. So I think it's really important, if people are choosing to go out and be a part of a demonstration, that they recognize, whether it's peaceful or not, but even peaceful demonstrations, that you should wear a mask. Probably eye protection, either a face shield or goggles, would be optimal. And really do your very best to try to social distance, particularly when someone beside you is being forceful with their voice. I think when demonstrations become more escalated, that there can be other concerns. The use of tear gas, for example, causes people to cry, they touch their face more, makes people touch their mask and things more. So I think there's certainly added concern. So, think about it, be safe, and try to make sure that you're in a place that you stay safe from a COVID standpoint, but also from the crowd standpoint.
Yeah. Well, thank you so much for your honesty and transparency and being willing to share your insights that you've taken away in the past few weeks. I think that's really great. It's, as you mentioned, it's the step we all need to take by saying, this is what I'm learning, and this is the step that I'm going to start taking today. And we're all going to work together for that better future, like you mentioned.
That's right.
So if you're just joining us, we're here with Dr. Theresa Brennan, Chief Medical Officer here at UI Hospitals and Clinics, talking about your health during the post-COVID-19 world. Please comment with your questions, and we'll answer as many of them as we can. So I want to get to some of the questions we've received on Facebook. Aaron asks, if two families have been quarantining, is it safe for them to get together?
Yeah, it's a really good question, and I think lots of us are thinking about that. I think the key is thinking about your own personal characteristics, whether you're a high-risk person that COVID may really cause you to have adverse outcomes or not. I think it's also important to think about what venue you're going to be in. We believe that probably being outside is a little safer than being inside, maintaining that social distance. It seems maybe not social or not human to be wearing a mask when you're trying to get together with people, but I would strongly encourage that we still are not through this, and still really important that we take those safety standards. Washing our hands again very frequently, particularly if you're having someone in your home, making sure that you then wipe things down with an antiseptic wipe or spray afterward. So I think you have to make decisions and priorities. This has been a long road for most of us, and at some point in time, we need to get back into near normal or more normal life and get back to seeing people. Just be sure to take those special precautions.
Yeah. I got my face shield a few weeks ago, and I've noticed that's been a game changer for me because people can see my facial expressions. I feel like I can actually have a conversation and not feel like I'm worried about my mask falling down or muffling my voice. And so I think if you have the ability to get a face shield, that does make things a little easier to be safe while still getting a little bit more of that human interaction that I think so many of us are craving right now.
Absolutely. Absolutely. Great point.
Well, thanks for answering that one. Luella asks, is it dangerous to breathe in your own CO2 while wearing a mask?
Yeah, for some populations, patients that have chronic obstructive pulmonary disease or emphysema, also called COPD, those patients may naturally retain CO2 in their body because of their challenge with breathing. And so those patients particularly might have trouble with rebreathing their own CO2. I think for the average person, for the average amount of time that they would be wearing it, it's safe. Certainly our healthcare workers wear masks all the time now with COVID. But even before that, when people were, for example, a nurse or a doctor who's in the operating room all day, they would be wearing a mask. And so in general, it's safe. And I would say if you have questions about your personal safety, I would have a conversation with your doctor.
Great. There's another question that came in from Facebook that's pretty similar, and I just wanted to see if you had any additional details you wanted to provide. Janie asks, does wearing a mask affect your blood oxygen level at all?
We don't have any data that that's the case. Generally, people get in more oxygen in normal air than they actually need, and most people, their oxygen levels are higher than a place where we would be concerned. When we look at oxygen saturations, acceptable is 90 to 100. Most of us are in the upper 90s, and so even if it went down a little bit, it may be okay. But for people with respiratory challenges where they may not have that reserve, it may be a challenge for them. And that's a place where a face shield is a great alternative, because that really doesn't limit the amount of oxygen coming in. The CO2 is more disseminated than it would be in a small mask. So it may, but for most people, it really is insignificant.
Thanks for providing that good piece of information. I didn't realize that about our oxygen levels. And so that's really interesting to know. And I think every time we touch on this, we learn a little bit more. It's such a new experience for us all to have to be wearing masks. And it's very easy, I think, to be worried about the risks that come with it. So I always appreciate you providing this information that helps us all better understand that we're going to be okay.
We're going to be okay.
We're going to be okay. Molly from Facebook asks, for the general public going to the grocery store or out to other stores, do you have a preference for which is better or which is more effective, a mask or a shield?
There's not great data to compare cloth masks and face shields, although our epidemiologists and I agree that a face shield does a number of things that a mask doesn't do. And we have had really excellent outcomes with having just the face shield. So for the first several weeks, our faculty and staff throughout the hospital, not in the COVID units, but throughout the hospital, were interacting with each other with just a face shield on, and our numbers of patients of staff being infected has remained very level, and that's really good news. So we believe that a shield probably is better. As you said, there's a lot of human things that make a shield more optimal. And in addition, if someone is hard of hearing, really putting a mask on really can be really challenging. We know that medical masks are better than cloth masks, and that's about what we know. So if you have a choice and you're open to a shield, I would certainly consider a shield.
Perfect. Deborah on Facebook asks, do we know yet if you can get reinfected after having the virus once?
Yeah, I think that's a question that we're still trying to figure out. What we know is that the vast majority of people who have had COVID will develop antibodies. Almost universal, but nothing is always. We know that some of those antibodies are what we call neutralizing, meaning they impact the virus and how the virus divides and spreads itself. And so we believe that in the short term, those antibodies are protective. What we don't know is how long they're protective, and we don't know whether someone can get COVID-19 again in the intermediate term or the long term. I think we'll know more, honestly, once the vaccine is available, because we'll be able to see how the vaccine affects people and whether with exposures, over time they're protected.
Great.
At this point, let me just say
one
more.
Sorry. Yep, go for it.
So at this point in time, our recommendation is even if you've had COVID, you should still take precautions. So for example, if we were to have a staff that had gotten COVID in the community or somewhere else, and then they came back to work, we would still have them wear the same protective equipment as everyone else.
That's a good reminder. I'm glad you mentioned that. So Shelly on Facebook asks, how does wearing a face mask and quarantining for long periods of time, like we have all been having to do, affect a healthy immune system, or does it have any effect on a healthy immune system?
Yeah, I don't think that we believe that it does have an impact. Certainly people are exposed variably to different bacteria and viruses that may rev up the immune system. We know that, and there really doesn't seem to be differences with people that have more exposures than less exposures with how well their immune system works when it's needed. We also know that people who get vaccines may have a various reaction, but then ultimately have a response to suggest that your immune system is there when needed, and it really doesn't require that kind of regular maintenance or exposure. So I don't think we believe that there's any concern.
Okay. So the last question we have on Facebook, I believe, is from Donna, and she wonders if you have any face shields that you recommend that people can order.
Yeah, you can go to local hardware stores or big box stores and see face shields. You can order them online. There are a couple kinds. There are ones that have a shield that's movable. I don't have one with me today. It looks more like a grinding mask or even a welder's mask, where there's kind of a little hat and then there's a headband and the shield can move up and down. Those are great. Some people find them heavy and don't feel like they can wear them for a long period of time. So if it's something that you're going to wear for a long period of time, you may want to go someplace where you could try that on before you buy it. There are also face shields that are more disposable looking, where they might just have a headband with a little bit of styrofoam to protect your forehead and then just the shield on the front. We have a lot of people here that are wearing those, and they're certainly reasonable. You just want to make sure that it covers your face and comes down to your chin or below, and comes around both sides of your face. And then I think the most important thing really is comfort. And then I think we all have to think about cost as well. Those more disposable kind tend to be less expensive. They may have to be replaced though, because they're probably less rugged.
Sure. Well, I just wanted to show this one, and I'm sure you can get these a lot of places, but I've got a young kid and she loves her shield that I got. It matches mine. So one, it's cool because it matches mom's, but it's also pretty cool because you look like a cat. So there's lots of fun ones. I make so many people at the store laugh when I wear that. And I'm like, good. If you are smiling right now, then it's a good day. So that, if you want to have fun with it, great. But like you mentioned, Dr. Brennan, make sure it covers your face. Follow all the safety guidelines that we've put out, and people can find that information from our epidemiologists and infectious disease specialists on our website or on our social media, right?
Yeah, and that brings up another point that you want to make sure that they're cleanable. So some masks might have crevices or things that make it hard to clean. So you just want to get something that you can clean on a regular basis.
Yep, perfect. Thank you for giving that guidance on the shields, because I know when I went to look for mine too, I was a little overwhelmed at all the choices there are. So that helps. So it appears that our country has shifted their attention a little bit away from COVID-19. There's a lot going on in our country right now. But does this concern you? And what do you recommend for people as we are still in a pandemic?
Yeah, I mean, I think having something that diverts our attention from COVID is good and bad. Obviously, what's going on is not on the surface good. It's probably, the long-term good that we're addressing these issues. Mm-hmm. But it gives people something to think about that doesn't have them so engrossed into COVID. I worry a little bit that means that they might not be thinking about it as much and therefore might not be taking the precautions. So, please continue to wash your hands, don't touch your face, wear your mask or shield when you're out, make sure you're social distancing. I probably used this analogy on Facebook Live before, but I can't remember, but I'll do it again. It's just like when you drive your car, right? There are multiple safety features that you use when you drive your car. You put on your seatbelt, you don't drive 100 miles an hour, right? You don't drive when it's in the middle of a blizzard. You don't drive intoxicated. So each of those things has an impact on safety, but really when you put them all together, that's when everything's the safest, right?
Yeah.
So I think the complacency that could, with people's attention being changed from COVID to something else, I think that because it's been such a stressful couple of weeks with the terrible incident with George Floyd, the demonstrations causing people to worry and be anxious, and I think that I've certainly seen more of my patients really be more down, depressed, and anxious. I think that it's hard on people to really be thinking about all these things. It's good that we're thinking about it, but it does take a bit of a toll, particularly right after COVID. Mm-hmm. People are already, stressed about the disease, worried about going back to work or losing their job, having to work in an environment that's different from them. So, I hope that the things get on a path of resolution soon, so that people can get back to more of a normal life. And as we talked about earlier, hopefully we've all learned something from this, and we can have that normal life be a better life for all of us.
Absolutely. Very, very well spoken. Before I let you go, is there anything else that you'd like our audience to know today?
No, I mean, I've said it before, we're not out of this yet. We're making progress. From our perspective, we're diagnosing less patients every day. And that is just such good news. We have less patients in our hospital today than we did a week ago or a month ago. So, I think we're making good progress, but, as I've said before, we haven't hit the goal line yet. So, let's take care of the ball and not fumble right on the goal line. So keep doing those safety things. It is so easy for us to say, things have slowed down and we can go back to normal. I don't think it's time yet. It might be soon, but continue to follow those safety standards that we've talked about, I don't know, a million times.
Well, I'm going to give everybody a reminder at the end, just like I always do. So we're going to hit it 1,000,001 times today. Thank you for being here again with us and taking the time to share your expertise with us, Dr. Brennan.
Take care of yourself. Everyone stay safe.
And thank you for everyone who tuned in today. If you joined us after we started, please make sure to go back and watch from the beginning of the broadcast to get all the great information Dr. Brennan provided today. And stay tuned to our social media accounts and our website, uihc.org, for all the latest information about COVID-19 and just taking care of your health in general as we move forward. Lastly, remember to wash your hands, cover your face in public, and take care of yourself and your physical and mental health. Thanks for watching.
Have a good day.